Good morning, everybody, and welcome to today's webinar in which we're going to discuss your COVID, HR and health and safety questions. And as usual, before we start, we would like to introduce ourselves. And for those of you who have not joined any of our previous webinars, I'm Victoria Templeton, one of the HR knowledge managers here at HR Solutions, and I'll be taking your HR related questions. And I'm pleased to introduce to you David Gregory from Essential Safety, and he'll be co-facilitating today's webinar with me. So he'll be taking the health and safety questions. And we're also joined by Sue Watson, who will be helping with the polls and in our discussions as we go through the webinar. And because we have so many of you that have joined us today, we have had to place you all on mute. However, as always, we do like to have questions. And whilst we ask for the questions to be submitted in advance, which has been really great for those of you that have submitted them, thank you. If you do have any further questions that come up as we go through the webinar, then please do make a note of them. And you have a question box in your panel. So I've just got a slide here just to show you how you do that. So on the GoToWebinar panel, which should look like something like this, simply just type in your question pane, and then what we'll do is we'll answer those live questions that come through at the end of the webinar. And for those of you who are regulars on our webinars, we do like to make our sessions as interactive as possible, and we will be running several interesting polls at the start. So when you do have a poll, it will appear on the screen like this, and when it launches, then we just ask you for your answer. But please note that in order to be able to participate in polls, then you just need to make sure that your screen is not in full screen mode, as for some reason it doesn't work in that setting under GoToWebinar. So just make sure you're not in that full screen. And so without further ado, we're now going to look at what. So we thought we would begin our Q&A session just setting out what the latest position is following the developments around COVID in the last week or so. And then we'll move to answering all your questions that you've submitted to us in advance. So we have pulled together the questions that have come in as part of that registration process, so thank you. And we'll also monitor as we go through the webinar for any new questions that come about on the back of any of our debate and discussion. And before we close the webinar, I'll just run through some areas of support that will be available to you and your employees, and then we'll bring the webinar to a close. A copy of the slides from today will be made available to you, so don't worry about that. You will get this information. So back on the 19th of January, the government announced that England would be returning to Plan A, and that, of course, is what we saw yesterday. But what does this mean? So the requirement to work from home, employees should be able to return to their place of work. Face coverings are now voluntary, and so it's up to individuals as to whether they choose to wear them, although the government is still encouraging the use. And it's no longer a legal requirement for events and venues to use the COVID-19 pass, but they can use it voluntary. And then separate to that particular update of the 19th of January, we'd already started to see some changes to other measures. So in particular, your self-isolation. So self-isolation rules have changed not only in terms of who is legally required to do so, but also for how long somebody has to isolate, depending on the vaccination status. So for those who are fully vaccinated, then obviously the original sort of 10-day isolation period applies generally when they have symptoms or tested positive. However, it can be they can come out of isolation sooner than the 10 days, and that's after 5 full days, but only with having 2 negative lateral flows that's then taken on day 5 and 6. So that's one big change to the self-isolation rules, and no doubt that'll have a positive impact for business. In terms of those vaccinated, then again, these individuals, as a starting point, you've got the 10 days for isolation, whether they have symptoms or tested positive, and they must also self-isolate if they live in the same household as somebody that's tested positive. So that's a big difference, I think. So everybody that's fully vaccinated, if somebody is in their household that is positive, that person can still go to work. And this slide here just is taken from the government website, and it is just sort of a visual, if you like, to help, because I guess it can get rather overwhelming, can't it, with all this changing information and what applies to who, when. So this is quite useful. We just thought we'd include it just to illustrate the different isolation requirements. Now, for those businesses where business travel is essential, then we will be seeing some changes from the 11th of February. And again, it depends on if the employee is vaccinated or not. So for the vaccinated, what's now needed for somebody coming back into England, then there's no longer that need for the lateral flow tests or to isolate on entering. But for those who are unvaccinated, then there needs to be proof of a negative COVID test that's been taken 2 days prior to travel, and then a PCR on arrival. But the isolation piece is only relevant if that PCR test comes back positive. And then finally, we come on to the Health and Social Care Act of 2008. The full title is the Regulated Activities Amendment, Coronavirus No. 2 Regulations of 2022. Those are regulations that are impacting massively across the health and social care sector. So they're going to come into force on the 1st of April 2022. As far as we know today, there is, I don't know if people have been following it in the news, but there's pressure on the government in delaying it. But at this moment in time, they are coming into force on the 1st of April. Now, these regulations apply to businesses and services that provide direct face CQC regulated social care activity. And it means that any employee or worker must evidence their vaccination status, or if they have a medical exemption, be able to evidence that exemption, and they must do that to a registered person. Now, under the legislation, a registered person can be an individual, can be a partnership or an organisation. So this is a significant piece of employment legislation. The government only last week issued the guidance notes around the implementation of the legislation, which only came about a couple of weeks ago. It got published weeks ago. So that's a really important piece. Do have questions on that I'll come to the webinar. And following on from that piece of legislation, I thought it'd be useful because we just had a case ruling delivered, and it's in the case of Miss Alette versus Scarsdale Grange Nursing Home. Now, it's a case that looked at whether the dismissal of an unvaccinated care worker was fair. You know, the dismissal was because their vaccination status. Now, before I detail the case, it is important to the context. It is one of the first cases to test the position of requiring an employee to evidence their vaccination status. The ruling isn't legally binding, but it perhaps gives us some good insight as to how tribunals may view these matters. Now, it's important that each case has to be judged on its own set of circumstances. And in this particular case, the dismissal of somebody that was unvaccinated occurred before the care home sector had any legislation in place to require that evidence of vaccination. So it's just important to set that sort of context for you. Now, in the case, the care home had instructed Miss Alette that she would require to provide evidence of a full vaccination status. It wasn't a contractual requirement, it was just considered by the care home to be a reasonable management instruction. Now, the care home argued that there is a risk of liability on their part in the event of a resident or even visitor contracting COVID from an unvaccinated employee. And they had been able to determine that, with the exception of Miss Alette, all other employees had been vaccinated. They also established that their own insurers would not provide public liability insurance because it did not cover COVID-19 related deaths. And so that's where they came to the decision that it was actually a reasonable management instruction to require everybody to be vaccinated. Now, in discussing the matter with Ms. Alette, she put forward her concerns. These were about her view, her perception of the safety of the vaccine. And she also claimed that it went against her religious beliefs, Rastafarian beliefs, although she wasn't consistent in making that claim throughout the conversation she was having with the employer. They came in late in the process. Now, although the care home had disputed it was a real reason for failing to receive the vaccine, as I said, she did only raise it late in the process, and she also added that because she had recently had COVID, she felt she was sufficiently protected. A disciplinary process took place and she was dismissed for gross misconduct. Now, actually, the tribunal ruled in favour of the employer and found that her dismissal was fair. Now, they believed that she herself had acted unreasonably. She failed to provide medical evidence to support her decision to not become vaccinated, or sufficient evidence of her perceived concerns over the vaccine itself. The judge and tribunal accepted that the care home's position wasn't anything to do with that her refusal wasn't anything to do with her religious belief, so they ruled that out. And the tribunal ruled that the instruction to require the vaccine as part of continued employment was proportionate, and that's really significant because under the discrimination laws and human rights, actions that are taken need to be proportionate, and they felt that it did not interfere with her right to a private life. So because of all this, as well as the fact that the care home's business was around dealing with vulnerable residents, providing care, as well as the fact that there was a pressing need at that point in time in the pandemic for care homes to take steps to reduce the spread of the virus, they had gone through a very challenging period faced by care homes. The judge actually felt that the employer was reasonable to actually carry out that dismissal. So I guess the learnings from that is that first of all, it's really important to understand the context in which your business operates, and emphasize the need for any reasonable employer to consider when you do make a policy that it is proportionate, and what's proportionate to one business may not be proportionate to others. And it's important to have a very thorough audit trail of decisions and investigations that you do. So in this case, the care home could clearly evidence they'd spoken with their insurers, they'd carried out research and in terms of looking at her claims about the vaccination. So this is a really interesting case. It's hot off the press. It's only come out this week. And as I said, it just gives you a feel for how tribunals consider the whole issue of where we stand with unvaccinated employees, which is, at this point, a very topical conversation for employers. And so finally, before we move on to the question and answers, I just wanted to sort of highlight to you the current situation with the virus itself. So you can see here the data from the take of the 25th of January. You'll see the number of people testing positive and patients being admitted are falling, but we are seeing high infection levels. So we know that the vaccination program is helping massively, because even though we're seeing high infection levels, we know that people that do go on to experience catch COVID, the vaccine makes it less severe for that individual. Of course, we need to still be mindful of those who may be more vulnerable to the virus, which we'll talk about more through the questions that we have got coming up. And so what does this mean for the business? We're reopening, yet we're continuing to have these high infection levels, and there are people in our workforce who remain still vulnerable. And that's where I think the nervousness and perhaps challenges are going to be for businesses about how we move forward. And hopefully today, through our Q&A, hearing what myself and David have to say from a HR and a health and safety perspective, it'll help give you some clarity about what our next steps need to be. And so before we go on to those questions, I'm going to run 3 quick polls just to see, get an understanding of where everybody is in terms of the virus, managing COVID virus in the workplace. So Sue, if I could ask you to kindly launch the first poll.
Okay, there we go. That's the first question. So will you be keeping your existing COVID-19 workplace measures in place? Just give it another minute for a few more votes to go through. Okay, I'll close that poll and I'll share the responses. There we go. So
Okay.
73%, quite high, that one.
It is. And so 27%. David, I don't know if you have any comment on there from a health and safety
Yeah, it is
perspective.
interesting because one of the points I was going to raise throughout this was just to say that just because legal requirements have changed and the government guidance has changed doesn't necessarily mean that you should change what you currently got in place, because you might still feel that it's suitable and sufficient to suitably protect your workers. So I think that's quite poignant to see that people, 73%, are still keeping things in place. Yeah, really interesting.
Yeah, thank you.
Okay.
And we've got a second poll.
Yep. Let's launch that one for you. So do you have a COVID-19 risk assessment in place already? Okay, I'll close that poll and I'll share the results with you.
Okay.
That's also quite significant.
Well, yeah, we did touch on it. There are obviously certain requirements for like 5 or more employees. You should have a written risk assessment, but for less than 5 employees, so that could be the 8%. But anyone that hasn't, that they're above the 5, I would definitely recommend that they get one in place, because even as of last week, I've had a client that's been on to me to say that HSE is still doing COVID spot checks, and it is still a legal requirement.
Interesting, thank you. And our final poll.
Let's launch that one for you. So when did you last review your COVID-19 risk assessment? Just let a few excuse me, there's a few more votes come through. Okay, I'll close that poll and I'll share the results. So there you go. So 67% within the last month and 22% within the last 6 months.
Yeah, again, interesting, because we've had a lot of government updates in the past month, within 4 or 5. I lose track myself, so it's really hard to keep up to date. But what I would suggest is that any update within government guidance or specific industry guidance, it should enact and give you the prompt to review your risk assessment to see if there's anything that needs to be changed, reflecting on the guidance and seeing whether what you currently control measures still in place are doing the job properly.
Thank you.
Thank you.
Right, I'll hide that one and over back to you.
Okay, and I think we're now ready to take health and safety questions and HR questions. So thank you everybody for submitting them in advance. So Sue, over to you to field the questions to us.
Yeah, so the first one we received is, what does the easing of restrictions mean for our business?
I'm quite happy to jump onto this one. Feed in after Victoria. Now, depending on what your business is, there'll obviously be different considerations that you need to take into consideration. But what I would generally say is, obviously, we've talked about the removal or the legal requirement for wearing face coverings. Now, as I just kind of mentioned, because that as the legal requirements removed doesn't necessarily mean that you should take that out of your current control measures, because you might still have certain areas within the business or the work activities that are being carried out where you still think is suitable for workers to wear it. So still bear that in mind. So don't just be quick to act and take it out of your risk assessment if it's still appropriate to have in there. Then obviously we've mentioned to do with keeping track of everything. Yeah, asking people to now, there's no requirement for them to be working from home. Now, again, depending on what your business practice is, you might still feel that that's a good way to manage the risk to workers. So I wouldn't necessarily just jump on board and say, right, everybody back to the office. I think what's key is good communication with your workers and keeping everybody up to date on everything. So whether that's up to date on your risk assessments, your policies or procedures reflected on COVID-19, it's definitely key. So before you do start having people back in the offices or your working environment, if you start to do so, keep everyone up to date, say what's changing or what control measures are in place, and even get their feedback to see how they're feeling about it, because obviously when you get people's input onto what control measures are in place, people are more likely to jump on board and be a positive impact on the working environment. So we've had face coverings, we just mentioned, we've mentioned working from home. Yeah, and I think for myself, and I apologise because I'll keep repeating to do with the COVID-19 risk assessment, but it does always come back to that for me. When there's any government guidance updates, for me, it should enact you and make you review your risk assessment, because depending on what the updates are, should then have a knock-on effect potentially to what control measures you've got in place. And I think over the next coming weeks, months, there's going to be more updates and changes. So kind of watch this space, and I hope that's helpful.
I think if I could just, I was going to add from a HR perspective, that like you say, communication is going to be really important, because you will have, no doubt, people in your workforce that perhaps will feel nervous, especially those that either live with people who were clinically vulnerable and were shielding at the time, people who are themselves clinically vulnerable and went through a period of shielding. So there will probably be an element of nervousness around, and I think having that open communication, regular communication and transparency to show in your workforce, like the risk assessments that you talk about, I think will help ease some of those worries and help people come back in, because we do want people back at work, and it's trying to prevent ongoing absences that you know, that obviously we can't sustain. So yeah, I think communication and just supporting, recognizing those that have been nervous about the pandemic.
Yeah, 100%. I think you know, keeping regular contact with line managers and their workers underneath them is key, and making sure that they know that you're really approachable. If they've got any issues, concerns, just have a quick chat. It doesn't have to be anything formal, just so that they can kind of air it. We can discuss it through and come out with a joint decision on what to do moving forward, I think.
Yeah. Yeah. I think it's also important to be consistent with how you deal with individuals as well, so that you don't end up with any inadvertent kind of discrimination claims if you treat people differently, that you have a genuine reason for treating them differently if you are trying to accommodate individual needs. Yeah,
100%. I think it's worth just mentioning here that there will be individual needs for certain people, and I think we cover it in some slides coming forward, but whether there's pregnant workers or, you know, people with personal specific health issues, then you might go on to do specific personal risk assessments for those individuals, so that would be slightly different.
Yeah, thank you. So our next question is, can we ask our employees what their vaccination status is? Now this one is quite a hot question, but and also I'm not sure if this was content specific, so I think we probably need to cover this from both the health and social care sector and also from the wider kind of business range, because we have had a lot of questions about this on our helpline.
Yeah, so if we park for a moment the new legislation that's coming in for the health and social care sector, and think of all other businesses and sectors, then it depends is my answer, because and I know it's not the answer necessarily people want to hear, but context is really, really important with anything from a HR perspective. So what we've got to remember is, from an employer's perspective, that you have to remember that the nature of the business that you're operating in. So what is the reason for asking the vaccination status? What are you trying to achieve by asking that question? Because it's obviously very much a data protection issue, because you're handling special category data, which is essentially medical information. And when you're handling, processing data, it's got to be fair, relevant and necessary for a specific purpose. So I think, as I said, parking the health social care sector for a moment, if you're to consider the need to ask it, you've got to really think about what it is you're trying to achieve as a business. Why do you need to ask that question? Because it's whether it will be a reasonable justification to ask that question or not. So it does very much depend on the business, the job role, you know, and the interactions that the workforce have, I guess, with the members of the public and customers, etc. So it's not clear cut, but potentially you can, but you just got to have that justified reason for doing it, and it's legitimate. Obviously, for the health and social care sector, you're asking somebody's vaccination status, and you've got a legal basis in which to ask it. That legal basis is this legislation that's coming in force on the April the 1st, or for care homes at the moment, they've had it since the 11th of November. So for those organisations, you've got a legal for asking that information. So yeah, so it's not straightforward. It can be done, but you've got to really look carefully at your context, your business circumstances, and why it is what it is it's going to achieve by asking that question.
Absolutely, and I think it's when you look at the challenges of even those who've got the legal basis for asking it, they've still got to do it very carefully with consultation, consider those who are exempt, consider those who you know, there is so much to it, even that process, that it's not something to be just implemented without any kind of careful planning and consideration. And I think that it will all boil down to whether you were reasonable in requiring that. Bearing in mind that the government have said it's self certification for most of the isolation and everything else. So that is quite, you know, something if you're asking them to prove.
Okay.
Okay.
So next question.
So the next question we have is, how can we get employees back into the office?
I'll jump onto this one then. Sorry. Yes, I think, again, we're basing this around offices. So considering what we've got in place, and I'm thinking we have an office space ourselves. So we're looking at what we've got in the office and the basics that have kind of been with us throughout control measure wise, whether it's adequate ventilation. So we're still making use of open windows, doors to get in fresh air into the environment, providing cleaning provisions, whether it's anti-bac wipes or cleaning products, looking at that, thinking about people's workstations. How long have they been away from the office? Do we need to review their DSE assessments? It's another consideration. Again, you can bring in face coverings. Now, depending on your setting and your office, you might be in a shared building, and then communal areas where the landlord's still got responsibility for, they might have their own policies and procedures in place. So I think just being respectful and mindful of those and asking your workers to do the same is a really good idea. Thinking, what we got at the office? Yeah, hand hygiene, encouraging people. Again, we can do it. There's a lot of encouragement here, and I think displaying posters, regular updates to the team, and whether it's encouraging people to take part in the vaccination programme, encouraging them to carry out lateral flow tests before they come in. Now, I wouldn't necessarily say it every day, but maybe if we said a couple of times a week, just to do something. Again, it's only encouragement. I wouldn't say that you can enforce this unless you put it into your own policies and procedures, if that's the case, but then you'd have to manage that appropriately. But it does feel a little bit heavy-handed, and that's more of a professional opinion. Again, people that are more higher risk, so whether we have got any pregnant workers or people with specific protected characteristics or health issues that we need to consider, making sure that we're reviewing their risk assessments to make sure that we've considered to see whether there's any changes that need to be made. Keeping regular updates for workers, so whether we're using health and safety notice boards, whether you're having your health and safety committee meetings, the meeting notes from that, inviting people into these meetings to get their input. Then considering outbreak management, I think, is another point as well, because within the guidance at the moment, there is still certain numbers that it asks you to contact to inform of if you have one person that has tested positive for COVID-19, there is a separate department, government-based, where they're asking for you to inform them. So that there's so much to consider. I don't think it's just as easy as get people straight back into the office. So don't jump the gun. Please consider every aspect that you think is appropriate.
And what's interesting listening to you, David, there is around, you know, we've just changes moving from plan B. It's not really any plan A, but actually it feels like from what you're saying, it's different. And I suppose that follows up on the slide that I showed earlier with the levels, the infection levels, the outset. The legislation might have gone, but there's still a need. I suppose the responsibility is placed on members of the public now, isn't it, and businesses to manage safely as opposed and advised or to do, sorry, under legislation. But it doesn't feel like much is going to be changing.
No, again, for me, I think shared responsibility fits nicer than the employer's responsibility, because everybody's got responsibility to themselves and others. So,
Yeah.
and not just having it on like your managers, because everyone needs to come together with this, and having their input onto deciding control measures is definitely the way forward. But yeah, being respectful of others, because everyone will have potentially different opinions on things and control measures, but listening to people, being respectful of it, and just going about your days. But yeah, I don't think there's one answer fits all here. It depends on your working environment and the specifics to what's going on with you as well.
Yeah, thank you.
So our next question is, how do I support somebody who is clinically vulnerable?
Okay, I suppose from a HR point of view, I guess some of it follows on from what David was just saying there. And I've talked about people feeling nervous, haven't I, a moment ago, and it's around communication. So meeting with them, seek their input in terms of what their concerns are now, get an understanding of their health. If you need perhaps get some medical evidence to support in bringing them back, then there's obviously the normal avenues like occupational health, seeking advice from their GP, and just sort of managing it as a process like that, as I guess any other health issues, linking in obviously with health and safety from the risk assessment piece. What adjustments do you need to make to the workplace, their job role, hours of work that perhaps can minimize any risk for them. As I said, I think seeking medical advice will be really important and valuable, because at the end of the day, you know, we're not medical experts, and I think consider whether their health condition falls under the Equality Act. Because if you gauge whether it's likely to or not, that will be able to tell you whether you're legally required to put the reasonable adjustments in place, because obviously there's that legal duty under the Equality Act, and their health issues could constitute that. Having said that, even if it wasn't true, you know, just from how you want to treat your employees, morally, it's, you know, the right thing to do, isn't it, to support. But I think understanding whether their health issues are likely to form a disability under the Equality Act is important. And ultimately, there is no longer the shielding for people. The government is saying to everybody to go back. And so from a, I guess, employment point of view, that employee's expected to be back in the workplace. And so it's how you support that, making adjustments as you need to, as necessary. And I don't know if, David, you've got anything to add as well from a health and safety point of view, but
yeah, some
I think
really
from
good points
HR,
to make
certainly
there.
the Equality Act is important to consider.
Yeah, all of those points really, really useful to consider. Some additionals I might mention would be, it might be a little while since you've asked people about their health conditions or personal circumstances, and some companies may ask about health questionnaires at the induction stage. So it might be a good idea, if you haven't already done so throughout the pandemic, about asking people to give you an update on where they're currently at, because I know myself, health conditions can change in a heartbeat. So it might just be worth asking people, and then on the back of what evidence then provided to you, consider whether we need to do a personal risk assessment with individuals. Now, just because they're back in the workplace and there's no guidance and requirements for clinically extremely vulnerable people to be either not at the workplace or working from home, it doesn't necessarily mean that there aren't additional control measures we should be putting in place for these individuals. So you might say that there are stricter restrictions for these people, and it'll affect them and their colleagues. So suitably and sufficiently, and being quite sensitive about the subject, having a conversation with them first, and then seeing what they would think would be good ideas to put into place to support them, and give them a bit more encouragement and confidence of being back in the workplace is a really good idea. But then at the same time, you need to think about how you can communicate that to colleagues that they're going to be working with every day, to make sure that they understand, because there's got to be some form of shared information with them, as long as the individuals that are vulnerable are happy with that.
Thank you.
So our next question is, we have somebody refusing to become vaccinated. Our business is covered by the new regulations.
Okay.
That's a fairly new situation, isn't it?
It is, and it's really tricky, and it's really sensitive, because people will have their own reasons as to why they're not choosing to take the vaccine. And I guess, it's about respecting that we all have a right to make decisions about our bodies, don't we? So it really is tricky and sensitive. So if we think ultimately there is a legal requirement placed on employers under that health and social care sector, and so if you think worst case scenario, the very end of the end, ultimately there would need to be a dismissal, okay, because otherwise that employer will be breaking the law and of the regulations. So it's how to manage a fair procedure to if you're in that situation. Hope that employers don't get to that situation of having to sit down with their employee and end their employment. We want people to be vaccinated. We should be encouraging, doing everything we can, education-wise, to encourage our employees to become vaccinated. But at the end of the day, employees need to be. So I guess if you're in that situation, like this, this person has obviously got this situation here, then it's about early engagement with that individual, sitting down informally, talking about the situation that the business are now in, because it's out of the hands of the person. It is a legal instrument that's going to be forcing them as to how they operate and the procedures they have to have in place from April. And so it's about sitting down, giving them avenues of getting support, and that could be signposting them to official information about the vaccine that will help alleviate any misconceptions about the vaccine, any hesitancy. You want to be directing them into the right, signposting them the right way. Then as an employer, if you can take steps such as giving them a reasonable amount of time out to go and get the vaccine, that will be really positive, because ultimately your aim is to get them vaccinated, not just obviously from an employment point of view, but society wise, we want people to be vaccinated. So anything that you can do to help encourage that, time out from the workplace to do it, education, putting them in touch with other colleagues that may have been hesitant but now have obviously gone and become vaccinated, those kind of things. And if you have regular communications and recording, capturing those, keeping your records, you may hopefully persuade somebody. Clearly, there will be people that will not change their mind. And so from a HR point of view, what your process needs to do is understand, okay, so would redeployment be an option for your business and for that individual? Is there opportunity to do it so that you won't be then breaking the law come 1st of April? And setting out the implications to the person about what happens if they choose then not to become vaccinated. And ultimately, if you're in a formal process then, because it will need to move to a formal process at a point in time, that would be technically a some other substantial reason hearing meeting. So there'll be a formal letter of invite, the right to representation. It's a formal hearing. You discuss what steps you've taken up to now, the support you've given, the reason why they need to be vaccinated to continue being employed, and ultimately an outcome of that hearing could be a dismissal with notice for some other substantial reasons. So that's ultimately where it can get, worst case scenario, but you just hope people change their mind and get vaccinated. But you will need a process of consultation with them informally to discuss what this new legislation means to them before you then go in a formal SOSR meeting.
Thank you. So definitely a challenging one, that one.
It is.
So can we require employees to continue with lateral flow tests? I think the important word there is require, isn't it?
Yeah. And again, I think what you need to understand is whether you've got a contractual right in place to do that, or whether you're choosing it as a reasonable management instruction, and therefore it's obviously a voluntary policy you're bringing in. It's similar to what I said at the outset with the other data protection question and handling medical data. You know, it's understanding, you know, the context of your business, what are you trying to achieve, will requiring lateral flows help you achieve that? And then, you know, the use of that data, it's got to be fair, relevant and necessary for those specific purposes. So it all links, for me, it all links back as well to your risk assessment. So your COVID risk assessment, where you're identifying where your risks are in your workplace, your work environment. If you, through that process, identify you need people to be carrying out, conducting the lateral flows, then that forms part of your business justification for doing it, doesn't it?
Yeah, I think you also have to take into consideration, if you are requiring them, then you may well have to provide them with tests,
yeah. Oh, yeah.
which will obviously
Absolutely.
cost the employer to purchase them, because I think there's a difference between asking employees to voluntarily do lateral flow tests before they come into the office is quite different to requiring them to do it. Yeah, one is a kind of more relying on the employee goodwill and consideration for their fellow colleagues. The other one is more of an instruction. So I think that's also, they need to establish, are they just asking them to do it and having a more informal policy, or are they requiring them?
Yeah. Thank you.
Okay, so the next question is, how can we be sure that when somebody returns to work after 5 full days of isolating, that they can, because they are fully vaccinated? There we go. Who's going to pick that one up?
I'll jump onto it first of all, but I think it's definitely a bit of both
good,
here.
practical and interesting.
Yeah, again, and I don't want people to get lost in the number 5 straight away, because so it's all about whenever you start having symptoms or whenever you test positive, and that day is classed as day 0. The next 5 days, and then when you get to day 5 is when you can take a lateral flow device test, and you should test then on day 5 and day 6, and they should be 24 hours apart. And as long as they are then both negative tests, you are allowed out from isolation on day 6 following that second negative test result. So I think it can get a little bit confusing when they say 5. People are like, oh, I can get out on day 5. Well, it doesn't really mean that. It means you can start to have your tests on day 5, then following 24 hours after.
But also it brings back to the whole question about vaccination, and you know, because it's only requires evidence of vaccination status, for every other business, there's no legislation requiring employers vaccination statuses, which is why it's a really, really interesting question. And I guess because ultimately there needs to be a practical way of being comfortable that that person so because they're vaccinated. And if you haven't got records of that, what do you do? So I think, and this hasn't been tested, has it?
No.
Would fall in and process be, you've got the government that's saying it's a requirement that you can leave isolation if you're fully vaccinated after 5 full days. So therefore, surely an employer, surely there must be a reasonable argument for an employer to say, actually, I need to understand whether you are vaccinated before letting you back in the workplace. And therefore, I need to just see your COVID pass. But as I say, it's not been tested and it's not come up.
I think there are potentially risks with that, because it depends again why you need to know, because that to date all of the isolation and the evidence has all been self monitored, and so you've just told your employer, I have COVID. There's no, you can self certify for 28 days, or you could do till Wednesday this week. So they are relying on the individual to be honest and trustworthy about self-declaring. And I think unless you are in a sensitive public-facing business, so there is a risk assessment, we're here again, that says there is a high risk of to your customers, which is why I think there's only legislation for the care sector, that actually it might be not deemed fair to insist on employees provide evidence that they are fully vaccinated and or have done 2 lateral flows that are negative. I don't know.
This is me kind of brainstorming a little bit here, but a view I've got is obviously as the employer we put together our COVID risk assessments, and as guidance from medical professionals is at the moment, people can be more vulnerable if they haven't had the vaccinations. Now, from an employer's perspective, if I've got employees that are then more vulnerable, then should I not then know that they are so I can then put suitable control measures in place to protect them more so than others?
You see why it's interesting?
Yeah,
because that would be a thought. Yeah.
And sorry, Sue.
I was going to say, we've had a subsequent question. It's about what extra consideration should we think about if we know we have non-vaccinated staff working alongside vaccinated staff, and that is kind of what this boils down to at the end of the day, isn't it? And if somebody calls in as positive on an LFT, are they able to request visibility of the test? This whole evidence piece has not yet been tested in court, and say at the moment, only care homes and soon to be the wider health and social care sector have legislation to back them up in requiring evidence. So, I mean, the mere fact they only brought it in for the health and social care sector, I think, has to be taken into consideration in determining your policy on requesting evidence. And I guess you can ask for it. It's just what you do if you're not shown it. So you might find employees that voluntarily want their employees to know they're vaccinated, want their colleagues to, to be comfortable with them being in the workplace, etc., etc. And so therefore, if their employer asks them to provide evidence on a voluntary basis, that might be the starting point, and just deal with the challenges if not everybody wishes to comply. And I guess the larger the organisation, the more challenging that is. If you're in a small office with just half a dozen people, it's probably much easier to manage and to work together on that. But for a larger organisation, that's much more challenging, I think.
And if we think back to that tribunal ruling, I know it's not legally binding, but obviously the way that judge ruled and considered the case, they did take account as well of the state of the pandemic at that point in time. And so I think decision making should also consider, okay, where are we in terms of the pandemic? What are infection levels like in our community? it's constantly evolving. I mean, in
Sorry, I think we've lost you, Victoria.
out of a peak of a wave. Sorry, you could be in the peak of a wave, or you might have just come out from a peak. And I guess there must be some consideration as well. If employers, through their risk assessment process, just question and consider, okay, so what's our local community like now in terms of infection levels? Do we need to be more stringent, relaxed, or not completely relaxed, but can we adjust them in any way? So I think that kind of thought process should probably come into it as well. And again, if you're in a tribunal, a judge will want to see your decision making, your thought process as to how you got to the decision that you've made. And if you can document it as well, you know, I mean, I can't answer what a judge will say, but
no.
and having a thorough, clear process will obviously is what you need to do or have in place.
Yeah, I think the process is risk assessment, justification, and then careful communication and considering any concerns around introducing that policy. What are the concerns, and take those into consideration before you make a final decision. I think if you're thorough like that and you document it, then you're more likely to be able to enforce something if you needed to.
Yeah,
I think we covered the whole the kind of COVID status part for employers. I think just going back to the whole how could you be sure that someone's was it
they can because they're fully vaccinated.
Yeah,
it's more the evidence, isn't it?
Yeah, I'd maybe even go as far as say, because once you do a lateral flow or a PCR, then depending on which one you go for, you'll either get a result from NHS Test and Trace, or you should be uploading your lateral flow device test results to NHS Test and Trace again, and then they send you a text or some form of email confirmation, which could then be shared with an employer. And again, you could request that, just so you could say, could we have a copy of this, just in case they come back and they could be the first case that spreads it around the office, and then there's an outbreak. Then at least it shows you requested information and you've kind of done as much as you kind of can do, really.
Yeah, I think requesting is the important word. You can request it. It's requiring it is the challenge. So I think, and as long as you're consistent again with all staff and not just treat individuals because you feel, if you ask one individual in the same situation and don't ask the next one, that's where you could get into difficulties. So I say it's request. It's request is the safe way. And we've had another question that is on the sort of similar lines. If we could just hang into this question for a moment. So even though the 10-day isolation requirement has been revised, the guidance says you should continue to work from home until day 10. So what would your advice be for a business in terms of determining whether someone should come into work prior to day 10 or not? So I guess that's more business specific again, isn't it?
It is.
Yes.
What role does that person do? Can that role be carried out at home? Because essentially, if it can, and the recommendation or the guidance is to do it, then yes. But if you're a work environment where it can't be accommodated, then going back over the risk assessment, I'd say, wouldn't it be, David?
Yeah, 100%. Again, I think there's a couple of different factors. The individual themselves, and that needed to consider their work activities, and like you said, whether that can be catered for. If they're office based and they've got a home workstation, then it is slightly different. But I don't know whether we could give one blanket answer to that, because I think it's open to interpretation depending on specific circumstances. Yeah,
it's case specific, isn't it, that one? Yeah.
Yeah.
But it's possible to bring them back. In certain circumstances. Okay. I think that's everything on that topic.
Okay.
So if we move on to long COVID. So somebody who's been off for a long time due to long COVID, should you do anything different to how you manage them, how you usually manage long-term sick cases?
Okay. Not necessarily. I guess sickness, ill health is ill health, isn't it? I think the important thing to establish really is whether their health issues would constitute a disability. So long COVID isn't it's a name, but the symptoms can vary person to person. It's whether the health issues that that person has experienced would qualify under the Equality Act, first of all. And so once you've sort of given thought to that, then that'll help you to understand your obligations in terms of reasonable adjustments. And so, as you would do with any other long-term ill health, if their health was to be deemed a disability, then yes, you would give them more time than somebody that doesn't have a disability in terms of any permanent impact on their ongoing employment. But generally, your process is your process, and it's how you manage that person through it. And long COVID, there was some data released the other day, wasn't there, about the significant number of people in the UK that's got it. It's so we're probably going to see more absence cases, aren't we, because of it?
Yeah, absolutely.
I think sorry, just jumping onto that from a safety perspective. Now I know it's looking at it from an absence perspective, but just thinking these individuals, it is a health condition, and there's symptoms that could be shown which long COVID is, and depending on whether they are off or they might even return to work still with long COVID, able to do their job. But again, apologies for repeating myself, but carrying out a personal risk assessment for these individuals, looking at their task work activities and seeing if there's any additional controls that can be put in place, even putting restrictions on certain activities, things like that need to be considered.
It's about reasonable adjustments again, isn't it? Because
exactly.
Yeah, as you would for any kind of long-term return or phased return, all those processes come into play, don't they?
Yeah.
Okay, so we offer contractual sick pay. Oh, this is another hot topic, isn't it? Can we give SSP only to those who are unvaccinated and who must self-isolate?
Yeah, so this, it is really complex, and I think it's getting a lot of press at the moment, isn't it? Because the likes of IKEA, Next, Morrison's, they're all starting to make policy decisions where they differentiate between vaccinated and unvaccinated. What we've got to bear in mind is, these are really large organisations. They might be prepared to accept and carry the risk that comes with policy because there is risk. So the impact for of this on a larger organisation is very much different to how it will impact a small SME. So it's really complex. There are risks around it. It's not being tested. But essentially, the risks around having different policies based on vaccination state, it comes back to potential discrimination claims, breach of somebody's human rights, because that the reasons for why they choose not to have the vaccine, as well as possible breach of contract claims. Not everybody can have the vaccine, whether it's because underlying health issues that's preventing it. They may choose not to because they're pregnant and want to delay it, or they may disbelieve. So there's we've got to just be mindful that people have their genuine reasons as to why they may not be taking it on the whole. So whether it's discriminatory, each case can be very different depending on, for each organisation. It's not clear. Potentially discrimination can be justified if there's no other way of achieving a legitimate aim. In terms of the other thing to consider is the self-isolation. You've got two elements of self-isolation, haven't you? You've got people that self-isolate because they have symptoms, they're unwell. You've then got people that may have to self-isolate because they've tested positive, but they just might not have any of the symptoms, and they might, they're confined to their room, but they might not be able to, they're not unwell. They can just still go about doing stuff. It's just they can't because of the how infectious it is. So whether your company sick pay, your contractual sick pay, is looking at the policy of that, the terms and conditions around it, when you award company sick pay, because as I said, if they're isolating but they're not sick, well, that's very different, isn't it? So I think it's very I think there's a lot of risk. There could possibly breach contract claims. And you've got that scope of where somebody can say, actually, I think it's because of my pregnancy or because of my disability. I don't know whether you've got anything else you would like to add, Sue, because it is very complex and you've got probably some thoughts.
Yeah, it is complex. And I think possibly the highest risk is from a breach contract claim. So you really need to study your contractual term around contractual sick pay, any policies around contractual sick pay. If there is a discretionary and you've made it non-contractual, that's fine, but look at what you've done in practice, because even if it's discretionary in your policy, but you've always paid sick full pay, you know, or half pay, whatever your rules are, consistently, then actually it would be deemed contractual just by mere custom and practice. So you need to look at all of that before you determine whether removing it, and you'd have to have a blanket policy for all. You couldn't just pick on the unvaccinated. Really, that is your challenge. You might want to say we're only paying SSP for any COVID related absences, which would be less discriminatory. There really is, it is a complete minefield, and we're just waiting for the first case on that. As Victoria said, that, you know, the large companies that have introduced it so far may well have a reasonable grounds for introducing it. They also have a large legal team that can help support them and have guided them through it. So it is something that probably needs some legal advice as to the potential costs, because if you're looking at breach of contract claims, that's one element. They are capped, but they're still, you know, range quite considerably between about 9,000 and 80 odd thousand, depending on the breach. But if it's just a pure deduction of wages claim, you know, you didn't pay them contractual sick pay, but you did pay them SSP, then potentially it's just the costs. You might be told to award the costs, but if they've had any costs as a result of you not paying them contractual sick pay, so if they've had extra interest payments, etc., then you might be liable for those as well. So, and obviously if you have one case and somebody finds out and you lose, then you might end up with a lot more. So it's a measured risk you would have to take, and you would probably need some legal guidance as to what the implications could be for your organisation if the worst case scenario, and how you could mitigate those risks.
Thank you. So I'm just conscious of time, so we do have a few questions, I think, Sue. So if everybody's happy to continue, we'll go through the last few questions. Is that okay, Sue?
Okay, yeah. So the next one is, what will I need to do if one of my employees reports COVID and thinks they've caught it at work?
I'll take this one, guys. Now, a couple of thoughts off the top of my head with this one is, initially, contacts and other people that might have been contacts of this positive case, just to make them aware, not giving specific detail of the person that they're a contact of, but just letting them know, and it might be advised to get a test to see whether they have then contracted it from being a contact. Now, on the government website, you can find the specific term of classification of being a contact, and there are a few points to consider, so I'd refer you to that. Then my next thought would be, the HSE, there's a requirement to report to them COVID, and there are 3 points under RIDDOR, and for this specific point that's been raised, I think only one would kind of be applicable, and it would be, if I just read it out, a person at work has been diagnosed as having COVID-19 attributed to an occupational exposure to coronavirus, and then it should be reported as a case of disease. Now, looking into, again, there's more information, so you might want to have a look at this. What I would say is, are they the first case of COVID in the setting? If they are, then the RIDDOR requirement you do not meet that requirement. If it's a case that one person has got COVID and then the person in this question is the second person, they could potentially meet the requirement for RIDDOR. But what it says is the responsible person, so whoever that is in the business, should make an informed decision on the information available to them at hand. Now, they're not looking for any thorough investigation of this, they're just looking off the basic information they've got available to them. And if that person thinks that it meets this requirement, then they should report it to the HSE. And it's as basic as that, really. I think those are the two main points really to come from that. What do you guys think?
Yeah, I think yeah.
And I think
Carry on, Victoria. Yeah.
I was gonna say there were good answers. I think from if I put my HR hat on, no doubt there'll be whispers, won't they, going round, and it's how you settle that to not unnerve other members of staff. So it's, I suppose, making sure your team knows that you have your risk assessments in place, you review them regularly, you communicate the outputs of those risk assessments, and you act when there's changes. And it's just reassuring your members of staff of those things. You know, at the end of the day, I suppose generally you can't necessarily determine exactly where it's caught, can you, if they've done other things as well, been other places, but you've just got to demonstrate you've been a reasonable and fair employer and acted when you've needed to and have all the measures in place. Yeah,
and what I suggest is obviously people that are confirmed contacts, NHS Test and Trace should get in contact with them to inform them of that anyway. But it's relying on either the positive case to inform NHS Test and Trace of that or the employer. So just bear that in mind. I think that's really interesting information to be aware of.
Thank you.
Thank you. So we carried out a risk assessment when our employees first started working from home. We are now going to make it permanent. What do we need to do? That's a common question we've been asked as well. Who's picking that one up first?
I'll jump onto it first of all. So initially now the HSE guidance around home working has changed over the recent months, and what they would say is if you haven't already done so, ascertain and develop a home workstation assessment. So DSE assessments, people might know them as, but it's a workstation assessment to see, and all you're doing is reviewing what equipment they're using whilst they're at home. So whether it's a computer, the chair, and their environment, windows, all such. So, but what I would be saying is be careful, because you can provide self-assessment forms for the DSE user to carry out themselves. But in order for them to do that, they should be trained and competent to carry that process out. If they're not, look at alternative solutions, whether it's a manager that's trained and arrange to potentially visit them at their home to support them with that assessment. Now, off the back of the assessment, depending on what the findings are, they should be reviewed with your line manager and then potentially new equipment provided. It all depends on what is highlighted off the back of that assessment. I think there's some other considerations to take into account. People that are working from home haven't got the readily available support just, you know, at a desk next to them, or the manager's just down the corridor. So keeping up regular contact, whether that's Teams meetings now that we've got this virtual facility which is regularly used as we are now, or giving them a phone call, or making appointments to have meetings at set periods, just to keep that, so they know that they've still got that support network there. If they need us, get in touch, or we've got this regular contact where they know they can bring their issues, concerns, or just catch-ups, really. Thank you. Very good. Yeah. So, got a couple of questions left, I believe. Which, yeah.
So, can we still require face coverings? Require, again, is that word? Require.
I think it would, again, go back to your risk assessment and whether you deem it to be a suitable and required control measure to protect employees. Now, I did kind of touch on it before. Now, you might have smaller areas, or, you know, your welfare facilities where you consider what control measures are available. And I think, again, thinking about the hierarchy of control and PPE. Now, face coverings are not classed as PPE under the PPE regs, but they're similar. So I would say that it should be more of a last resort of what you want to ask people to do, because they're not particularly nice to wear, and I don't think we want to really ask people to wear them where they don't really need to. So just think about whether you could potentially put capacity restrictions on entering areas if you feel that's appropriate. But if you think it is required and it needs to be put in place to protect your workers and others who are affected by your work activities, then you can still ask for them to be worn. But again, it would need to be put into your procedures and your policies, and it would be down to you to manage that.
Yeah. Yeah, management. So from a HR point of view, it's about being consistent in, if you're acquiring it and then people aren't following it, it's being consistent in how you manage the people that don't follow it. But, you know, because you'd argue it's a reasonable management instruction that you require the face coverings.
Absolutely. So, we've got a final question and one additional short one that was submitted during the presentation. So
okay.
we have, would it be fair to take an employee to disciplinary for a COVID absence when government guidance wasn't followed and no PCR result has been provided?
So essentially, your policies still apply, COVID, non-COVID. So I think your normal processes and your normal management of your company's policies are the same. I think if somebody is due a disciplinary hearing, whether that's to perhaps attendance levels, I don't quite know from the question, or whether it's about their conduct, so as opposed to capability and attendance issues. When you're in that process, the normal options will still apply to that chairperson. So they would, you know, in any hearing, they should be considering the context of the case, the mitigation that's put forward by the individual, whether as an employer they either have confidence the behaviour will change or they have confidence that the person's attendance will improve. You know, they're key things that should be central to decision-making processes when somebody is in a formal meeting. Specifically with regards to the government guidance wasn't followed and the PCR hasn't been provided. I think you know, it's, you know, what steps has the individual taken to avoid them being in a situation? So whether it contributes to a sanction or some disciplinary action being taken, I think it's how it impacts on the workplace, I think, is important as well, because it's got to be affecting work. That is why they're in the meeting. Don't know if you have anything to add on that, Sue, but
yeah, no, I agree. I think it's very context specific again. Pretend it wasn't a COVID absence, it was an absence and they didn't follow whatever rules there were, you know, and deal with it appropriately, investigate thoroughly, give them the chance to submit their own response to it, so that in case there's something you're not aware of or there was a reason the guidance wasn't followed, and take it from there, really. I think it's significant is to the whole context of the case. But yeah, you could potentially discipline someone. It's just based on the facts of the case. You'd have to look at.
Thank you.
Yeah,
I've got one tenuous point which might be worth just mentioning. It's not really that scenario, but it's just worth a point being said, I think. Just that it is illegal to knowingly require or encourage someone to come to work if they're legally required to self-isolate. So again, it's a bit far to link it, but I thought it's just worth mentioning.
Yeah, thank you. And just the one final question we had was about the amendment to the Health and Social Care Act and whether it impacted community pharmacies. I think you need to look at the roles in your pharmacy, because if you are one of those pharmacies that administer the COVID jabs and the boosters and flu jabs and things like that, and or provide some care, direct face-to-face, CQC regulated activity, then maybe one of your roles might be impacted. But if it's other roles, such as in the retail side of the pharmacy, then there may not be. So I think you have to look at what the role does and if they are in a CQC regulated activity or not.
And that leads us nicely on to our next slide, actually. But before we do, are there any other questions, Sue?
No, that's everything. I covered most of them during the other questions.
That's really good. And so I was just saying that actually leads us nicely onto this next slide, and we just wanted to share with you some supporting information that you've got access to. So we provide a free COVID-19 risk assessment template that's on our main website. It's through our doc shop. So the links are here. So when you get the slides, you know, you've got the. We also have guide on COVID-19 and managing that return to the workplace. Again, it's on our doc shop. For any of you on our webinar today who is a knowledge-based user, so has access to all our template letters, template policies, guidance articles, how-to guides, then we are going to be launching literally any day new documents to support this new health and social care legislation. So if you do operate within that sector, then be sure to look out for those new documents. And what we have in place, we have announcement letters, outcome letters, we have the SOSR invite outcome, loads and loads of information, and we have an employee guide and employer guide as well. So they're going to be going live any day. And then also we have our regular COVID-19 updates that we always share on both our main website as well as knowledge base. So you get all that information as a knowledge base user, and with extra things like your template letters to help you navigate through the world of COVID, which, you know, can't quite believe we're still saying it 2 years on. So hopefully you'll find that information really helpful to you and your employees. Before we wrap up, there's just a few closing slides. And this one really is just to ask to do a poll. So if I could ask you to open it up, and it's around whether you feel that you'd like some help for you and your business from us in any way and would like us to contact you on the back of this webinar. So if you do, just let us know which of our services you'd like to find out, and that can be the HR services, HR training, the HR knowledge base, talked about health and safety services and training, and of course payroll. So just while Sue opens that poll, it'd be great to hear if you'd like us to follow up with you.
Yeah, that's launched now. And also do get in touch with us if you're not a knowledge-based user, if you're interested in any of the documentation. Certainly if you're a client, contact your consultant, but even those of you who are not clients of ours already, do let us know, and we can see what we can sort out for you.
Thank you. So
right, I'll close that one now.
Lovely. And then, as usual, before we bring it to an end, just a few closing slides. So it's for anybody that's interested in our ILM Level 3 award in leadership and management. We're running sessions from February, and that's for those who have management responsibilities but no formal training. So really ideal for your team leaders and people that are leading teams of people through organisational change. So if you are interested in that, then please do follow up with us, and we can provide more detail on that. And we also offer ILM Level 5, the next level up. So and that's more aimed at project managers, department heads. So about developing people's skills and experience and help improve performance for ongoing development and career progression. So these start from March. Again, both of these are online, and let us know if you would like some more information on that. And then for those of you that are regulars to our webinars, it's always good to have you join us. So we have some coming up. We've got the Why Employee Retention is Key to Success and what you can do to improve it. That's in February. We've got the importance of welfare meetings, advice and guidance for line managers. And then we're actually focusing in April around disciplinary process, and in particular how to write legally compliant conduct allegations. So lots of, when I say normal HR topics there, non-COVID. And then we also have some health and safety webinars coming up. So next month we've got the Why Do We Bother with Health and Safety? And then in April we have an introduction to food safety. And they're all free, of course, to come along and join. And so if you do want to stay in the loop and be amongst the first to be invited to our webinars, receive our latest news, then please do sign up to our newsletter, which you can do so here. And it will give you all the latest HR and health and safety news. And then before we go, we'd just like to provide some contact information. So obviously you've got the HR Solutions information there if you'd like to get in touch. And then we've also got David's information there. If you have any follow-up questions, then please do get in touch with us and we'll be happy to help. And then as usual, we like to receive feedback. So there is a short survey that comes out on the back of the webinar. So we would just really appreciate it if you could just spare a few moments, just take the time, because it helps us with our ongoing webinar library and content. And it's always good to receive feedback, constructive, positive, what have you. So please do, if you can, take a few minutes. And then that brings me to the end of today's webinar. So I'd just like to say huge thanks to David for sharing the load of answering the questions with me. It's nice to have somebody else join in the webinar, and thank you, Sue, as well for fielding the questions and giving me your insights as well. So it's been really good. Thank you both, and thank you everybody for taking time out. I know everybody's busy in January, so thank you, and we hope to see you on our next webinar. Thank you, everybody.
And thank you, Victoria.
Thank you.